Welcome to Arazy Group's regulatory update. In today's update, we're going to give you a regulatory wrap-up in Kuwait that will include information related to the key regulatory changes under Ministerial Decree MD 387/2025. Ministerial Decree 387 of 2025 was issued by the Kuwait Ministry of Health and represents the current legal basis for new regulatory changes. The version in force is version 1.0, published in December 2025. The focus here is on identifying regulatory elements that were not previously formalized in Kuwait's medical device and IVD framework and that now affect submission strategy, review timelines, and compliance expectations. Kuwait has formally introduced 3 different regulatory review pathways. This is a structural change as earlier submissions followed a single general process. The authority can now apply different levels of review depending on the nature of the device, its urgency, and whether it already holds approvals from trusted regulators. This change brings flexibility while maintaining regulatory oversight. The standard pathway represents the traditional regulatory approach. It requires a complete technical dossier and a full assessment of safety, performance, and compliance. This pathway now applies when products do not qualify for reliance or expedited review and ensures a thorough evaluation before market entry. The fast-track pathway applies to devices addressing urgent healthcare needs, such as life-threatening conditions or public health priorities. Access is accelerated but not unrestricted. Eligibility depends on prior approval by a recognized reference authority, ensuring that the product has already undergone a robust safety and performance assessment elsewhere. The abridged pathway formalizes regulatory reliance. Instead of repeating a full technical assessment, Kuwait can leverage decisions already taken by recognized authorities. This reduces duplication, improves efficiency, and shortens timelines while preserving regulatory confidence through verification of equivalence. Our regulatory information and registration management software is the answer to all your regulatory needs. With an intuitive user interface and real-time data, License Sale provides complete project management, infographic analytics, effective collaboration tools, future market access planning, and advanced reporting capabilities. You'll control your global medtech registration activities like never before. These authorities are explicitly recognized as reliable sources for prior approvals: FDA, USA, EU CE Mark, MHRA, UK, Health Canada, PMDA, Japan, TGA, Australia, and Visa, Brazil. Reliance is conditional. The product submitted must be exactly the same as the one approved by the reference authority. Any change in design, intended use, or manufacturing location may invalidate eligibility for the abridged or fast-track pathway and result in a full regulatory assessment. Administrative processes are modernized by accepting electronic certificates and official electronic verification systems. Where digital verification tools are available, paper legalization is no longer required. This reduces administrative burden, cost, and processing delays while increasing efficiency. The decree explicitly addresses advanced and complex technologies. Software is clearly regulated as a medical device when it meets the definition. Substance-based devices, nanomaterials, and active devices are covered with specific regulatory consideration, reducing ambiguity and supporting consistent classification decisions. The local authorized representative is assigned stronger legal and regulatory responsibilities. The role now includes clear accountability for compliance, regulatory communication, and post-market obligations, reinforcing local oversight and control.
Thank you for following our regulatory updates. If you have any questions, need more information, or would like to book a demo of our software, please email us at info@arazygroup.com or simply head to our website and head to the Contact Us page.